Okay, semua dah masuk So, now, the next one is for diabetes type 1. Okay, and for this one, it's for you to classify and explain the use of different types of insulin preparation. You got to know pharmacokinetic properties, what are the adverse effects for the preparation, mechanisms of action of the preparation, identify and relate drug interaction, discriminate the types of insulin preparation. Well, ini kita cerita insulin sajalah. Okay, not that difficult compared to the first one. Okay, cumanya you must be able to identify or differentiate the pharmacokinetics of the preparation. Okay. So what is this? What is insulin? You know what is insulin, what is the preparation, because the insulin preparation or the formulation that they have, it's different. Ada different sizes, different pharmacokinetics, and the reason is actually to bring down the blood sugar level and the level of HbA1c. Okay, so it is a polypeptide connected with disulfide bond, and the pro-insulin is cleaved to form insulin and the C-peptide. Okay, sources is through the production of recombinant biotechnology that contain human insulin, in which the gene is being inserted into vector, transformed into a host cells. Usually they will use E. coli, and then production of multiple copies of insulin gene, transcription of multiple copies of pro-insulin, and then cleave the C-peptide, and then harvesting of the insulin, and then they do the quality control, and then after that they will do the formulation. You don't have to know, I'm just putting it there. Okay, so and this is the milestone. So you can see that it started from 1922, in which insulin has been isolated, and the treatment of the first patient in 1922, and you can see 1939 there is another preparation of insulin, protamine, and after that 10 years later another formulation, and then it goes on innovation of insulin formulation or preparation. Sebab sekarang pun dah ada insulin pen. Okay, so now mechanism is to activate glucose transporter on the cell membrane to cause glucose uptake into cells, inhibit glucose production from the liver, promote glycogen synthesis, inhibit lipolysis, and help to normalize blood glucose level and also metabolism. So basically, the action sama macam insulin hormones lah. Okay. So it helps to regulate blood glucose level in the liver, uptake of glucose in the muscles and fat cells. Okay. And basically it helps cells to take the glucose to be used for energy. Okay. And if the body has sufficient energy, then insulin will actually signals the liver to take up glucose and store it as glycogen. Okay, yang ni boleh tengok sendiri video dia. So the types of insulin ada 4. Rapid acting insulin, short acting insulin, intermediate or long acting insulin, and long acting insulin. Okay, long tu maknanya longer lah daripada yang atas ni. Okay, so rapid acting within 5 to 15 minutes, short acting, the soluble or regular insulin is within 30 minutes, intermediate or long acting is between 1 to 3 hours. Okay, long acting insulin, the onset is 30 to 60 minutes. Okay, so this is the onset. The peak. So rapid acting, within the onset 5 minutes, it can go up to peak to 30 minutes, after 30 minutes or within 60 minutes, but the action is about 2 to 5 hours, and it can be injected at the start of a meal. Okay, so onset about 5 minutes, 15 minutes, within 1 hour it can go to peak of the action, and the duration of action within 2 to 5 hours. Short acting, onset is about 30 minutes, peak within 1 to 3 hours. The duration is about 4 to 8 hours. It is usually injected 15 to 30 minutes before a meal. Okay, so selalunya yang before a meal, it's the short acting lah. Kita kata short acting or regular insulin, and it can act within 8 hours. So maknanya breakfast, and after that you want to take dinner, then you have to take it again. Okay, because dah habis dah masa dia. Okay, so intermediate or long acting insulin, onset is within 1 to 2 or 3 hours. Peak is within 4 to 8 hours. That is used to control glucose levels between meal, maybe combined with short acting. Whereas the one that has no peak and duration is about 1 day, usually taken once daily. Okay, so these are the 4 classification of insulin preparation. So in a way, ada 4 groups. Okay? Okay? This is the book. So you can see this is the insulin structure. Okay, the types of insulin preparation, the 4 types. Okay, so you can see that it differs in the time of onset, the time to peak, the duration of action, because the difference in the polypeptide length. Okay, and the dose, site of injection, blood supply, temperature, physical activity will affect the duration of action of insulin. Okay. So the objective is to manage hyperglycemia, maintain acceptable level of HbA1c, and prevent ketoacidosis. Okay, so this graph is showing to you the time profile of the different insulin formulation. So yang ini, yang biru kat bawah ni tak ada peak. So long acting insulin analog, the whole day, taken once daily. Zinc lente insulin, okay, it peak after 10 hours, okay, yang hijau ni. And then we have protamine isophane insulin. So you can see the difference in peak, what time, the time taken for the insulin to reach the peak concentration. Okay, and then the rapid insulin analog is here, soluble insulin is there. Okay, so how it is being administered? So you have to know how insulin is being administered in usual condition, in emergency condition. Okay, subcutaneous or intravenous or continuous subcutaneous infusion. Okay, so all 3 is correct, but depending in which condition. Okay, so insulin is actually degraded by insulin protease in the liver and the kidneys. Okay, so available regimen, you have bolus injection therapy or insulin pump, and then in diabetic, that is diabetic type 1. Diabetic type 2 is insulin plus oral hypoglycemic agent. Okay, yang ini I rasa atas ni sama yang macam saya cakap tadi. It's just that kita ada example here, rapid and short acting. It's kita ada insulin lispro, regular insulin, insulin aspart, insulin glulisib. Okay, administered to mimic mealtime release of insulin 15 to 30 minutes before meal or immediately following meal. Okay, so it depends on which insulin that you are looking at. Okay, rapid and short acting, clear solution. Okay, please baca. Ada example, I think you can actually read it on yourself. So the mechanism of insulin release, saya rasa I have gone through tadi. Okay, ada apa-apa pasal insulin? Short sahaja, tapi walaupun short, very important. I tell you one story. Okay, story dekat sini lah. Ada 1 year tu, saya tak bagi exam pasal oral hypoglycemic agent for antidiabetic medication. And more than half of the class, they cannot answer about insulin. I don't know why. It is equally important. Okay, even though it is for type 1 diabetes mellitus, but you still have to be, you must be able to identify which is the insulin preparation. I'm not saying for which patient, but it got to be for which preparation that actually describe which insulin. Okay, so jangan lupa baca. Jangan rasa tak important. More than half of the class, saya mark tahun tu exam very easy. 0,0,0,0,1,0,0. Kan? Walaupun soalan dia tak banyak, saya rasa soalan dia saya tak ingat lah. Walaupun soalan dia berapa markah je, it's not like the whole question tau. It's like mungkin 3 markah, 4 markah je. Tapi kalau you tak boleh jawab, you jawab salah, you are not able to identify the situation, you give the wrong answer. So maknanya tiada maaf bagimu lah, memang kosong. So that is the question, that is apa kata, soalan yang menentukan you pass or fail tau. Sebab walaupun you rasa sikit je ni, tak apa, I can cover in other parts, tapi sebenarnya salah. Okay, because that year I think the issue was student just di spot question. Walaupun saya tak pernah bagi tahu spot question yang mana. I think that was the year yang we discuss about why the student banyak yang fail. Okay, because they spot the question yang mana akan keluar. Tapi tahun tu suddenly we decide that the case is actually for type 1 kot. Kalau tak silap saya, aku tak ingat macam ni. Tapi tak boleh jawab, it's so frustrated. Soalan tu tak pusing kat mana-mana. Soalan tu very straightforward, tapi more than half of the class tak boleh jawab. So kalau soalan tu actually menentukan pass or fail, then it's very sad. Sebab sikit je, tapi tak boleh jawab. And kita nak student pass, kita bukan nak student fail. Okay, so make sure jangan spot, baca saja. Saya dah bagi in terms of macam mana you nak tengok, macam mana you nak tackle, because this is a big topic. Okay, a big topic by itself. Okay, so any question? Tak ada. Okay, so please tengok balik. have a look at it again. Okay. Now, adjunct therapy, amylin. Okay. So, amylin is adjunct therapy, and the only drugs that I can find is known as pramlintide. Okay. It is a novel approach in treating diabetes mellitus. So amylin is actually a polypeptide co-secreted with insulin. Okay, and like insulin, there is some deficiency of amylin in people with type 1, and there is a changes in concentration in people with type 2 as well. Okay, and suppresses of glucagon secretion in postprandial period. Okay, so that is the role of amylin. Okay, so amylin ni bukan untuk ganti insulin, tapi dia adalah adjunct therapy to insulin. Okay, so how it act? It bind with calcitonin receptor, and one of the receptor known as RAMP1, RAMP2 or RAMP3, resulting in delays gastric emptying, improves satiety, decrease postprandial glucagon secretion, and cause weight loss. So, pramlintide is able to decrease the dose of insulin. Okay, tapi dia tak boleh diganti, insulin. Okay, so this is adjunct. Now, this is the precautions that you need to take into consideration. Cautions to be taken: hepatic insufficiency, renal insufficiency in insulin preparations. Okay, different types, species of insulin, different properties, injection techniques, presence of insulin antibody, site of injection, individual response. Okay, and patient should not interchange insulin type or species without medical supervision. Okay, so this is the adverse effects: severe hypoglycemia, confusion, sweating, tachycardia, coma, seizure, okay, general weight gain, or it could be edema. Okay. So this is the drugs that can interact with insulin. Banyak. Jangan hafal ya. Jangan hafal. I don't think you can hafal. It's a lot of them. Cuma please tengok yang kita kata drug interaction insulin with corticosteroid. Okay, what does it do? Okay, with other anti-diabetic drugs. So in a way, if you are able to understand the mechanism of action for the group of drug, you are able to actually predict what is the potential interaction of the drugs. Okay. And another condition besides elderly that you need to take into consideration is gestational diabetes. Okay, because some mother is facing gestational diabetes. Okay, during their pregnancy. Okay, I'm not going to comment on the physiology of it, but this is the management of it: monitoring of mother and fetus, non-pharmacological intervention, pharmacological intervention. You can give insulin therapy or you can give oral hypoglycemic agent, and there are other management as well. Okay, so that's about it from me. Thank you very much. Is there any question? My email, my phone number. Thank you.
Thank you, Doctor.
Thank you, Doctor.